you tell me your name and date of birth?
Brooke Horridge, 1896.
Do you know what day it is?
November 28, 2016.
And do you know where you are right now?
At the UMKC clinic.
Good. So she is alert and oriented ×3. She has a calm behavior. She doesn't seem anxious at all. She has a very relaxed posture. She's sitting erect. And I'm going to move on and look at her head and her skin. Her skin seems warm bilaterally. There's no lesions noticeable right now, but throughout the rest of the assessment, I'll examine the rest of her skin under her clothes. I'm going to assess her skin turgor. Is it okay if I pinch you?
Yep.
And I'm just looking for a snapback, which I see. You have good skin turgor on both sides of the hand. I'm going to look for any signs of edema on my ankles, which I see none, so that's good. And moving on to the head and the face, I'm going to inspect her hair. It is evenly distributed. She has an enormous cephalic head. Her hair is well-groomed, well-kept. It's not very coarse and also not too fine. It's very normal. And her face looks symmetrical. I don't see any lesions or scratches. Her nose is midline. Her lips look normal. Okay. Then we'll move on to your eyes. I'm just looking at the external structure, her eyebrows, everything looks symmetrical, everything looks just really good. Good. And I'm going to do the internal structure. I have a pin I'm just going to look at her conjunctiva, which looks pink, and not inflamed, not irritated. Her sclera is white, irides are blue, and her pupils, we're going to test for perla, which means pupils are equally responsive to light and accommodation. Equally round, responsive to light and accommodation. So they are responsive to light, and as normal, both pupils constrict when one is exposed to light, which is a good thing. And for accommodation, I'm going to have you focus in the corner of that room over there.
Okay.
And when I tell you, I want you to focus on my finger.
Alright.
Okay? And focus on my finger. So her pupils converge and constrict when she looks at my finger, which means that perla is intact. Okay. For her extraocular muscles, cranial nerves 3, 4, and 6, we're going to test the cardinal fields of gaze. So follow my finger with your eyes without moving your head.
Okay.
Don't move your head.
Okay.
Good. Very good. All right. And we're going to move on to the ears. So I'm first going to look at her external auditory meatus. I see piercings on this side, but I don't see any redness or irritation on either side. And I'm going to test for any tenderness. Does that hurt?
Mm-hmm.
How about that?
No.
And I'm going to push on the tragus. Does that hurt?
No.
Okay, I'm going to look inside of her ear and see if I can see the cone of light.
I would sit still.
Very good. And on the right side, her cone of light is at 5 o'clock. And on the left side, her cone of light is facing at 7 o'clock.
Drop something.
Okay. Moving down to the lower half of her face, I'm going to inspect her TMJ. Can you open and close? And I'm just looking for any crackling sounds or any tenderness. Do you have any pain with that? I'm going to be clench your jaw. Good, so that's testing cranial nerve 5, which is intact. Her temporal artery. I feel a slight pulse, nothing bounding. Good. And for cranial nerve 7, your facial nerve, I'm going to have you smile, frown, and puff out your cheeks, and wrinkle your forehead. Good. So cranial nerve 7 is intact.
Yep.
Continuing with the ears, we're going to test her cranial nerve 8. So can you plug your left ear and repeat after what I say? I'm
Yep.
going to whisper it.
1, 2, 3.
Good. Plug the other ear and do the same thing. ABC.
ABC.
Good. Okay. For the mouth, I'm going to look at her lips, which look a little bit dry, probably because of the weather. Her teeth, I don't see any caries, anything that would raise an alarm. Her teeth look like they're hers, which is good. Her gums are good and pink, nothing really abnormally red. Her buccal mucosa is a very normal color, pink, no edema, no swelling, no inflammation. You stick out your tongue. Good. Her tongue is midline. That tests cranial nerve 12. And can you say light, tight, dynamite?
Light, tight, dynamite.
Good. And I'm going to have you open your mouth and say ah. Good. So she has uvula mobility. That tests for 9 and 10 cranial nerves, which are intact. Moving on to the neck. I'm going to first try and palpate your lymph nodes. Is that okay?
Yep.
Starting with the preauricular, the postauricular, occipital, submandibular, submental, superficial cervical, jugular gastric, posterior cervical, deep cervical, and supraclavicular. Yeah. I'm going to inspect her nose. I knew I was going to forget the nose. Her nose is midline. The outside looks normal. And I'm just going to take a look on the inside real quick to see if I see any inflammation or anything abnormal. And everything looks good on that side. And you're good with this side too.
Oops.
You're falling off. And to test the patency of her nose, I'm going to have you plug one side of your nose and breathe. And the other side. Good. So her nares are patent. And for cranial nerve 11, I'm going to have you shrug against resistance. Good. Okay. So eyes, nose, mouth, neck. Okay. Let me grab my stethoscope. And for the neck vessels, I'm just going to see if I can listen to any carotid bruise with the bell. Stethoscope. And I don't hear any. And now I'm going to test your range of motion. So can you turn your head to the side and to the other side, forward and back, and can you circle all the way around? Good. So she has very good neck range of motion. Can you do the same thing against resistance?
Yeah.
Good. Perfect. So range of motion is good, and her neck muscle strength is very good too. Okie dokie. I'm going to see if I can palpate her thyroid. I'm going to go with the anterior technique. So to do this, I'm going to have you turn your head to the side and push her trachea a little bit to my left, my right, and swallow. And I cannot palpate her thyroid on this side. And I'm going to have you turn your head this way, push the trachea this way, and swallow. And I cannot palpate that way, which is a normal finding. And anything else for the neck? No. Nothing else for the neck. I'm going to move on to her lungs. First, I'm just going to note the overall structure of her chest. It looks very symmetrical. I don't see any horizontal ribs. They're all downward sloping. There's no sign of being barrel-chested. I don't see anything abnormal. She has a 1-to-2 ratio. So I'm going to see if she has a symmetrical expansion. Putting my hand here, can you inhale and exhale? And one more time. Good. So my hands expand symmetrically as you breathe, which is a good normal finding. And now I'm going to listen to your lung sounds. Is it okay if I lift your shirt
Yeah.
up? And just take a deep breath in and out through your mouth.
Okay.
Just normal breathing, okay? Good, so I don't hear any adventitious sounds. If I did, I would have her test for fluid in the lungs or anything like that. I didn't hear any crackings, but if I were, I would have her say E while I auscultated, and if there were any fluid in her lungs, I would hear it as ah through my stethoscope, but there was no signs of anything abnormal. And I'm going to go to the front. In the back, there were bronchovesicular sounds here and vesicular sounds lower. In the front, I'll actually hear bronchial sounds, bronchovesicular, and vesicular sounds at the lower side. So go ahead and just take a lot of deep breaths for me.
Okay.
But if you start to feel unconscious or faint, don't feel unconscious. If you start to feel faint, let me know. We can stop and move on to something else. Okay. Go ahead. Good. So likewise on this side, no adventitious sounds. Good. All right. Now, while we're auscultating, I'm going to move on to your heart. I've already tested for carotid bruits and felt for your carotid arteries. I felt a normal pulse, very strong. Good. No bruits. I'm going to see if I can see any jugular distension when you lay down. It's normal for you to see a distended jugular vein as the patient lays down, but when the patient sits up, the distension should go away. Sit up, and it does. So, very good. And an abnormal finding would be for the jugular vein to stay distended, which could be a sign of heart failure. All right, so I'm going to listen in your 5 fields of sound, starting with your aortic valve, your pulmonic valve, the herbs location, which you won't actually hear any heart sounds, your tricuspid, which is where you kind of have your apical pulse, and your mitral, which is over to the side over here. Good. I'm going to have you lean forward. I'm going to assess for a murmur at the base of the heart. At the base of the heart, you can hear S2 the loudest, which is at the top of the heart. And at the apex, you can hear S1 the loudest. So I'm going to have you lean forward and exhale while I auscultate at the base. Go ahead. And I hear no murmurs. That's a good thing. And for another, 2 other heart sounds, S3 and S4, they can best be She has a 74 pulse, 2 plus regular rhythm. Nothing out of normal range. Very good. And now we're going to move on and assess the abdomen. So now you lay back. If it's okay, I'm going to put your shirt over.
Yep.
So before I do anything, I'm just going to inspect her abdomen. She has a very flat contour, not sunken in, not protuberant. Very normal, very good. Now I'm just going to auscultate in the four quadrants to listen for vowel sounds. And her vowels are active right now. So I heard sound in all 4 quadrants. If I weren't to hear anything, I would have to listen for 5 minutes in each quadrant, so I would be able to say no vowel sounds present, but she has vowel sounds present, so she's okay. Now I'm going to percuss, again in all 4 quadrants. And it should be a tympany sound. Any dullness might indicate there being a mass, or maybe just a normal finding. And you'll hear a dull sound over the liver, like an organ, or the spleen. While I'm here, I'm going to assess with my bell for any abdominal bruits where the aorta would be. Or renal bruits, that would also be something. And I don't hear anything, which is a good sign. Now I'm going to move on to palpation. Starting with light palpation, I'm really not feeling for anything other than possible masses. This is more to make the patient comfortable with the examination. And moving on, I'm going to do some deep palpations in all 4 quadrants, assessing for any mass or enlarged organ. Anything out of place. And I don't feel anything abnormal. That's good. Now I'm going to attempt to palpate her liver, spleen, and kidneys. Her liver's on this side, so I'm going to use the hooking technique. I'm going to have you take an inhale, and on the exhale, I'm just going to reach under. Go ahead and breathe out, and see if I can feel the liver, which I cannot. Oh, and also while I'm on the side, I'll try and find her kidney using the duckbill method. And I cannot palpate the kidney, which is normal. And over here is where her spleen would be, so go ahead and I'm going to do the same hooking method. And exhale. And I don't feel any mass or anything, so musculoskeletal system. So while you're sitting down, we are going to do your range of motion. You've already done your neck. Let's do your shoulders. Can you abduct and circumduct? Good. Can you do the same thing against resistance? Abduct, adduct. Good. Don't have to do that against resistance. Her arms, can you flex and extend? Can you do that against resistance? Good. Her hands, flex your fingers. And while I'm on her fingers, I can test her cerebellar function by asking you to pinch your fingers to your thumb repeatedly, just like this. Good. Cerebellar function is intact. And while your hands are here, I'm going to have you flip your hands over and back in a rapid motion. Good. So cerebellar function is intact. Moving on to your knees. Can you extend and flex them? Good. Can you extend it against resistance? Good. Same with this one. Your ankles. Can you flex against resistance and extend against resistance? Good. So for the rest of the test, I'll have you go ahead and stand up and test your hips. So move your hip forward and back and to the side. Abduct and adduct. And same with the other leg. Good. We've done your knees, we've done your ankles, wrists. Go ahead and spin them around. Flex, extend. Can you squeeze my fingers? Good. Her grip is equal bilateral. Can you push your fingers out against resistance? Good. So that's also equal bilateral. She has a strong muscle strength there. Test your spine. So we're going to flex it and extend and go to the side and rotate. Good. And while she's standing, I'll test her for the Rombergs, which requires her to stand with her feet together, arms at her side, with her eyes closed for 20 seconds. And I'm just going to look to see if she has any imbalance problems, swaying. Good. Nothing abnormal. You can go ahead and sit back down. We're going to test the rest of her cerebellar function. I'm going to have you touch your nose, touch your finger, and then go back to your nose. Good. And now I'm going to have you run your heel down your shin, both sides. Good. Okay. So, done all of your cranial nerves. Reflexes. Almost forgot reflexes. So, I'll start with the patellar reflex. We're going to test just right below the kneecap to see if her leg will move. Good. Okay, and we'll do her brachioradialis. Good. Good. see if she can respond to light and sharp touch with her eyes closed. So, you just tell me if you feel a light or sharp touch whenever you feel it.
Sharp. Light. Sharp. Sharp. Light. Light. Sharp. Sharp. Light. Sharp. Light. Sharp. Light.
Good. She passed that test. And I think I'm good. I'm good. Okay, I think I'm good here. That'll conclude our assessment. Do you have any questions?
No.
No? Okay. Have a good day.
Thank you.
Thank you.